we formed this group, the Single Payer Network in Florida. Progressive Sarasota is part of it. Claire and Nikki did all this research, which I'm going to brag on you guys. So it turns out that when you look at what is the total cost of buying employee health coverage within a public employer, right? So they looked at the Sarasota public school system. And when you look at what is total payroll and what does 6.25% look like, how much money is that? And then they looked at how much are they currently paying to buy health insurance for people. And the difference was $28 million a year. That one school district in Florida could save on an annual basis, $28 million a year. And we were like, we must have done that wrong. We must have added those numbers wrong. And so we sent it off to a friend of ours in Massachusetts who's been doing this work around single payer and how much money they would save in the public sector in Massachusetts. And he was like, nope, you're right. We were like, wow, $28 million. One school district in one state. So we put, okay, so this is 67 counties. Sarasota is kind of a mid-sized county, right? So let's just multiply 28 by 67. It's $1.5 billion a year that could get funneled back into public education if we had single payer. It's shocking. It's shocking. Most companies are going to be better off under a single payer system because they're going to pay less in taxes than they pay in healthcare costs now.
The money that employers are paying out of pocket depends on how healthy or sick their employees are too. So like, just to give you a personal example, so my dad ended up end-stage renal disease, got a kidney transplant. The company that he was working for was a small family-owned company. He was paying $400 a month out of pocket for insurance. They were purchased by a conglomerate that owned 12 other trunking companies. And they came to him and said, you as an individual transplant patient who takes an anti-rejection drug that costs $6,000 a month, you across the board are raising our out-of-pocket expenses by 30%. So they canceled his insurance and said, we're going to give you $100 a month to go out and buy your own insurance.
Yeah, I don't understand why the idea of health care is still being linked with employment. I mean, it wasn't always this way. And it makes no sense to me. And why should a person who's employed by a company, their health care essentially cost twice as much as a person who's unemployed and just paying their half? I mean, I think it's ludicrous. Isn't it more progressive to figure out a system that just takes employers out of this altogether?
That's what this does.
I mean, here's another factor that comes into play in terms of employment, right? As a group that suffers under the current system, if you have a job that you hate, but you have health insurance and you have, well, everybody gets sick at some point, everybody. Like, nobody doesn't get sick at some point. So, but if you have a job that you hate and you need your health insurance, you're kind of trapped in this job. And, I would even describe it as indentured servitude, right? Like, you can't get out of this job that you have until you're 65 when you can get Medicare, right?
Yeah. If what we're doing is doing away with the insurance companies, we're also doing away with a whole lot of jobs.
Absolutely.
And you were pointing out, in fact, that not all of the money that is being saved is from profit. In a way, that would be deterrent to wanting to support this. If what we're talking about is we're going to have even more unemployment.
So this is a very good question that, of course, nobody in the insurance industry would even remotely attempt to answer because they want us to be afraid. 470,000 people work in this industry. And so in HR 676 and in S 1804, there is a specific transition plan for those workers. There's a specific plan for retraining, helping to find new jobs, looking for ways to do what they call a just transition, and they would get paid, I believe it's for 2 years. They would maintain their salary. I think it's 2 years. But there's a very, very specific transition plan that you guys should look up. But it's because of specifically that. Like, we're supposed to be the good guys, right? If what we want to do to create a sane and healthy system that provides health care to people based on need, the last thing we should do is throw hundreds of thousands of people out of their job, right?
I mean, the state still needs to have people working If you have a single payer, you've got a machine that needs to be distributing
Right.
that money, right? So there will be people who need to be hired there.
Some number of them would do that, but it would, in no way would it employ everybody.
No.
When you look at under a Medicare for All system, right, where you have a single payer, and the incentive is to keep people well, the lower, the sort of more entry-level care is prioritized. Right, so you don't say, oh, as an insurance company, I'm going to make more money if people go to a medical doctor for something that they really needed a nurse or a midwife or a nurse practitioner or a physician assistant, or there's many levels of care. Not everybody has to be in an MD's office for every single thing, right? And so the incentive is to go to the level of care you need, not the level of care that costs the most.